Hi, I'm Eric. Today I'm going to be demonstrating a EJV, which is your extrajugular vein cannulation. Now, we've decided to go with this type of cannulation because our patient is really sick and we can't gain any IV access anywhere else, so we've decided to go with this. Now, if your patient is conscious, let your patient know what you're going to do throughout the procedure. For this particular video, my patient is unconscious. So now we've placed our patient in a supine position. I've got his head at approximately a 45, 60 degree angle. I'm looking for that EJV, which is just there on the lateral side of the neck. You can hopefully see some distension. If you can't, then certain ways that we can get distension on this vein is we can try the Trendelenburg position, which is we will actually invert the patient with the head slightly lower than the rest of the body, try and get some backflow of blood back towards the head. I could also try tamponating that supraclavicular space, see if we can get some distension that way. The hepatojugular reflex, which will place some pressure over the liver, or we could try and elevate the feet. For this particular video, we've gone with a Trendelenburg position. Right, so now we've got some good distension of our vein, so we're ready to cannulate. Got all my PPE on, present. Gonna give this area a really good wipe down. I've done all my drug checks with my crew partner. All my saline, other drugs are all within date. Check the correct drug is present. And we're going to cannulate, okay? Now for this video, because we have different equipment from what you have at AUT, I have my lure is placed on my syringe with saline with 5 mils in the syringe. Okay. Also, instead of using a really large bore cannula, I'm just using a 20 gauge for this video. Okay, sharps are out. My sharps is out. I'm going to tamponade here in the supraclavicular space. I'm going to place my thumb up here, get some tension on my jugular vein. I'm going to come in at approximately maybe 15 to 30 degree angle, which may vary depending on the size of my patient's head and neck. Begin, in, find my vein, advance all the way through. I'm going to tamponade that down, remove, into my sharps. Here, there we are. Now I'm just going to aspirate this, make sure I've got flashback here. Yes, beautiful, good flashback. Now flush this through a few mil. I'm going to remove my saline. You'll notice my lure is still in place. Now things I want to look for, often we can have some complications with this type of cannulation, such thing as a pneumothorax or an air embolus, nerve damage, vascular damage, interstitial infiltration or extravasation. So I look around my site. This appears to be a patent cannulation. I'm just going to close this off with my tegaderm. I note the date and time of the cannulation. Just check again. See, no fluid moving outside of my area. That looks good. I've got my IV line set up here with my bag of fluids, date, correct drug, all in place. I've bled this through so we have no air within my line. We're going to apply this to our cannulation. Now to finish this off, I'll find a place to tape this. I'll tape it behind the patient's ear and probably across the forehead. One more check. Yes, good cannulation. Ready to continue on. Thank you.